one of the things that I see a lot of is people who end up with prediabetes when they have biotoxin illness, because insulin is actually an inflammatory mediator. So when we eat food, especially carbohydrate, sugar and starch, our body puts out insulin to bring sugar into the cell so that it can be used for energy. Insulin can get elevated when your body has a lot of inflammation, and the beginning pre-diabetes stage is actually elevated insulin with a normal blood sugar. Sometimes what happens is your body puts out insulin for other reasons, like you have a lot of inflammation. Unfortunately, when you have high insulin, you can start having low blood sugar because insulin's bringing too much sugar into the cell and your blood levels of sugar are getting too low, and that doesn't feel good. Sometimes it's almost like your body becomes deaf to the fact that there's a lot of insulin out there, and it doesn't do that, and your blood sugar gets higher and higher because insulin isn't being very impactful, and then you end up with diabetes eventually. But even if you don't have diabetes and it's just this pre-diabetes type of state, because of inflammation, insulin's high, you start gaining weight around your middle in particular. So insulin is a fat storage hormone. It also prevents you and blocks fat burning. And so a lot of people gain weight around their middle in particular, really anywhere, but around the abdomen is very common. Sometimes when people have biotoxin illness, it actually leads to these other situations and other conditions. But treating biotoxin illness and getting rid of inflammation is treating the real cause of that. We still manage elevated insulin, elevated blood sugar, but ultimately they have to treat biotoxin illness to get resolution. There are a lot of conditions that can result from biotoxin illness, a lot of autoimmune diseases, including celiac disease or Hashimoto's thyroiditis or Behçet's disease. And it's sometimes hard to sort out, is this the actual cause? Is this the actual diagnosis, or is this a result of biotoxin illness? And that's my job to do.